everyone. Dr. Rashid here. Just wanted to talk to you about the inpatient drug chart. So this is a common scenario that comes. It is kind of mandatory. There are several things. If you see the marking system for the inpatient drug chart or for the prescription, there are the marks for data gathering, the marks for the IPS and management. It is important that you first of all understand where you get all those marks from. Is any communication, or what sort of communication it is, and also what is the data gathering and what is the management. So those are the important bits of your prescription when you see the result card. Now let me show you a typical drug chart that you get in your exam. This is a drug chart. On the top you see a few columns, then in the middle, then at the bottom. These are different areas for different things. Now, talking about the management part, talking about the data gathering and IPS. So, management and data gathering are usually something that you will find in the scenario. However, the IPS is mainly the communication, which is a non-verbal communication. Okay, which means that you need to write your name. You need to write the GMC number. The instructions should be clear. It is how you communicate with the others by writing. So this is non-verbal written communication with the others. So it is important that you write the GMC number, your bleep number, put your signatures, put your name. Those are the important points for the IPS. And if there's any special instructions, like if any medication needs to be taken with the food, any medication needs a drug level check, so it is important that you write them clearly to get the maximum marks for the IPS. Talking about the data gathering, it is very straightforward. You will get the information from the scenario, the age of the patient, name of the patient, and the placement, why the patient needs a medication, like the indications of the medications, and what sort of drug doses for them are required, like the regular and PRN or as required medications once only. So these are the important points that you can collect from the scenario itself. I want to show you what the first page looks like and what are the components of the first page, where you have to write the important information. On the top, if you see, this is a place where they ask you to write the name of the consultant, department, and the date when you are writing this drug chart, as well as the date of the admission of the patient. So these are the important points that you need to write on the top left corner, and on the top right corner on page 1 is patient information place, where you have to write all the information about the patient. Next, just in the mid on the top where there is a little box for the VTE prophylaxis and VTE assessment. So you need to tick that box if your task says to perform the VTE assessment. Then at the bottom, just below the patient information and the department information, there is a column for drug allergies. It is important that you write all the clear instructions and all the medications in the food if the patient is allergic to, and put your name and the signature and write the date, as well as any type of reaction. Many of the time the patient may confuse yourself or maybe confuse themselves because they don't know exactly what the allergy is and what the intolerance is. Many of the time they simply write nausea. They may say constipation as an allergy. So it is important that you find out. And in some situation where the patient has allergy to multiple drugs, and we have very narrow spectrum to prescribe any particular medication, we may need to go ahead with the least reactive medication. So that's why it is important. If you are doing the screening for serious contagious infections, it is important that you tick that for that box for MRSA or C. diff or MSSA. Then at the bottom, just in the middle, you can see once only in the pre-medications. These are the places for where all the medications which are which require the loading dose or which are just one off, you can write in here, like say for example, if you want to give any patient doxycycline or nitrofurantoin, they have the initial dose is different. Similarly, vancomycin is one of the example that you see in your practice very commonly. So you need to give the loading dose. One other example is a digoxin, where you have to give loading dose of the medication. So it is important that you write in here. Make sure that you write in clear words, and I prefer to write in capitals all the medications to avoid any confusion, to avoid any misunderstanding. And write your name, your bleep number, and the date and the time when you want the patient to have it. Then at the bottom you see the bottom box is for the oxygen. It is important for those patients who have the respiratory problems, who have respiratory distress, so you prescribe them oxygen. So any patient who does not have the COPD, the oxygen level required is above 94, and those who have the COPD, we aim to keep it between 88 and 92. So that is important. And if you see just at the bottom, there are the device codes. So device codes you can see on here, VM% for the venturi mask. If you are giving the oxygen through the venturi mask, it is important that you write in the instructions the VM% instead of writing venturi mask. That's a long word, it will save your time as well. Then simple face mask, you can write SFM, and H% is a humidified oxygen. Non-rebreathe mask is NRB, nasal cannula. So you have all those device codes for the oxygen delivery device. So you can write, if you see in here, just head towards the bottom, you can write the name of the devices. Now go next to the next page is the antibiotics page. It is given on the page 2. So you have to write the names of the antibiotic very clearly, their start date, their end date, and if there's any special instruction, like if you want to check the levels of the medications, then it is important that you write that in the special instructions. A few of the medications like gentamicin, and they need the patient needs a testing of their hearing, so it is important that you write it. And vancomycin, we need to check the levels of the drugs, because it can affect the kidney functions because of the nephrotoxicity. So it is important we write that as well. However, we check the level just before the 4th dose and continue giving the 4th dose as well. Now going to the next page is the regular page. This is another page where you have to put the sticker of the patient or write the information of the patient as well as of the department wherever the patient is staying. This is for the regular medications. Any medication that you want to give the patient regularly, you should write on here. Now you must have seen, or you may see, there are quite a few scenarios which does not ask you to give dalteparin and AES. On the top two columns, top two boxes are for dalteparin and anti-embolism stocking. These are the mandatory drugs, I must say. These are pre-printed, so there is no reason for you not to prescribe it unless it is contraindicated. If you don't, you will be penalized. So it is important that you write the dose of dalteparin. Any patient who is hospitalized, unless it is a child or there is any bleeding disorder or there is any other clear contraindication, should get dalteparin It is 5,000 units subcutaneous, and usually it is given in the evening. You must write the date when you want to start, and in the instruction or in the additional information you can write for the VTE prophylaxis. Similarly, anti-embolism stockings are for any patient who is in the hospital, so you must prescribe this. The dose of AES is 1 pair, and it has to go on both legs. So in the dose you write 1 pair, and in the root box you write on both legs. Then you write the date, start date, and in the additional information you must write for AES or VTE prophylaxis. Now, because the socks are to be worn 24 hours, they should all the patients should be wearing them all the time. So it is important that you encircle all the rounds. That's morning, midday, evening, and night, or the bedtime. Then you can see in here regular drugs prescription box. In this you need to write the date and time when you want the patient to have it, and write any special instruction. This is very clear. You have another page for the regular medications. If the patient is taking many regular medications, and you must use the next page. Then is the last page, second last and the last page. And the second last page you write all the medications as required medications. You may be proactive, and you may write the other medications even if they are not given in the prescription task. Say for example, if the scenario says that the patient has been admitted with the fever, write antibiotics to the patient, but they have not asked you to write the paracetamol. It is important that you get you think about the whole situation and write the paracetamol after checking the allergies, of course. Write paracetamol in the as required medication. If the patient, you feel that the patient may be in pain or may develop in pain, say for example the patient is coming with a septic arthritis, and your task has said you to prescribe them co-amoxiclav, and a few other regular medications like atorvastatin, amlodipine, or any other medication, but they have not asked you to prescribe ibuprofen and paracetamol. To get the maximum marks, you can always write PRN or as required medications. You have the liberty to do it, and that will count towards management. These are the important points that you need to consider in any prescription. Then is the last page is an anticoagulants page, where you have to write any anticoagulant for the patients that you're going to prescribe. And in that case, what you need to do is come back to the regular page 1 and cross delta parent clearly diagonally and put your signatures and write the date. That is important point. And go through all the columns of your prescription given on the GMC website. You can download a free copy of that and get it printed, and try to practice as much as you can so that you can score the maximum marks. Prescription is very easy, and it is very good station to marks a maximum to get 12 out of 12. So you should not lose any mark in such scenarios. I hope that you learned. I wish you all the best of luck. Keep it up, and hoping to see you soon on the wards in NHS as my colleagues. Thank you.